Hi, everyone, and welcome to a webinar for a privacy update for regulated health professionals. My name is Kate Dewhirst. I am a health lawyer, and I work with health practices all over Ontario. Today, we are going to do a whirlwind of privacy, and there's a lot to cover, and I'm really grateful because many of you sent questions in advance. As a reminder, I cannot provide legal advice in a webinar like this, but I will be providing general information that I hope will help you in your practice every day. We're going to cover a lot of ground, so I get your bang for your buck here. We are going to talk about privacy lingo, recent updates to privacy law in Ontario, safeguards, prevention, and privacy breach management. What do you have to do in your practice? And then I'm going to answer some of those questions that you sent in advance. Because we can't cover everything in this webinar, there are some handouts where you can continue your learning about privacy. So the slides are available. You will not have to write everything down. I did add some extra content in the slides. I will share information verbally, but there is some extra content in the slides as takeaways for you that you can read after the webinar. There's also a summary of general privacy issues. It's a few pages with some visual cues and reminders for you to understand privacy. Then there is another document called the privacy prescription. That is for all of you who have your own practice, who are a health information custodian, for you to understand the basic steps for your compliance with the health privacy laws in Ontario. And then finally, there is a summary document. We have an Information and Privacy Commissioner in Ontario who issues decisions and orders from time to time, and I've summarized all of those for you. They're color-coded, they're organized by topic, and it will help you to read and understand the stories of privacy, maybe bring a little bit of life to your privacy practice, understand when things can go wrong, and what steps that you can take to do privacy correctly in your practice. So those are some handouts for you to review after the webinar. Let's get started. And we're going to start off with some lingo so that everybody is on the same page. There are some acronyms. It's healthcare. Of course, we're going to have some acronyms. So a couple things for you to know. One is language of health information custodian versus agent. So there is an acronym, a HIC, Health Information Custodian. Health information custodians are responsible under our health privacy law, the Personal Health Information Protection Act in Ontario, to comply with that law. Agents have to comply with the rules that are set by the custodians. So how do you know if you are a health information custodian or not? The law, the Personal Health Information Protection Act, gives a list of who is a health information custodian. Now, for regulated health professionals, that's not as straightforward as other places. If you are working in a hospital, if you are working in a community health center, those kinds of entities are named in the law. But so too are regulated health professionals. So healthcare practitioners are custodians. If you have your own practice, you are a health information custodian. If you work in a group, then the group has to decide if there's a single health information custodian or if there will be multiple custodians within the group. That is something that you have to decide as a collective. If you're employed at a hospital, a family health team, a business corporation, or for example, a community health center or any other place of employment, you are likely an agent. When you're an agent, it means you have to follow the privacy rules that are set by the place where you work, your employer, or if you have an independent contractor agreement with a custodian, you have to follow the rules, privacy rules that they set for you. This will also be the case if you happen to be a student. Students are agents under our health privacy laws. Again, you have to follow the rules of the place where you are doing your student placement. Another key term that we will use in this webinar, and that's common in health privacy conversations, is personal health information, or PHI as an acronym. So there's a definition of what is personal health information in the law, and it starts off that it has to be identifying. If you have truly anonymized a record, there is no way that it could be linked back to an individual, then none of what we're going to talk about today counts as personal health information. So totally anonymized, do not worry about privacy. However, removing someone's name from a record does not necessarily de-identify that record or anonymize it. There still could be enough data points in that document or in that record to link it to an individual. So if it's identifying information about someone's physical or mental health or their family history, if it relates to care that you provided to them or that they received, or your name linked to an individual patient or care recipient, or the name of your organization or business or the agency linked to an individual, their health number, information about their body parts, body substances, tests, or exams, and if they have a substitute decision maker, that is also health information. A lot of healthcare providers think that the only record of personal health information is the chart or the electronic health record that you keep or the paper health record that you keep. But actually, our privacy law broadens out our understanding of what is a record of personal health information. And if you look at this list, emails to patients, emails between colleagues, text messages, voice messages, handwritten notes, quality improvement reports, complaints, documentation and responses, risk management forms, referral information about someone who is not yet a patient of yours, a fax from another clinician about a patient, a research database, an appointment book or online schedule, scrap notes, video surveillance tapes. All of these things can be records of personal health information if it meets that definition that I just shared with you. So if it's identifying information about the care that you provided to someone, even if it's not in that traditional format of a health record, it can still be a record of personal health information. Now, that matters in two ways. If you have records of personal health information, you have to protect them. So we're going to talk about safeguards in this webinar, but you also have to provide access to all your records of personal health information on request. That does not mean, let's go back to that slide, that when someone says, I'd like to have a copy of my chart, that you have to go sort through all of these things. 99% of the time, someone means their traditional health record that you hold about them when they want a copy of it. But just be mindful that people can ask you for the specifics of things that you hold about them in other formats. So we do see cases that have gone before the Privacy Commissioner where patients have asked providers for example, a copy of a video surveillance recording, and they have had to hand that over. So video surveillance recordings, all of these kinds of transitory notes can be records of personal health information that you have to provide a right of access to. I should pause there because some of you will have a question and you may be panicking that you don't keep some of those transitory notes. Let's just go back for a moment. Scrap notes, handwritten notes, you're not keeping them. That's okay. You don't have to keep transitory notes. You will want to securely dispose of them when you're finished. You may not keep a voice message or emails. You don't have to keep those records. The issue is if you do keep those records, then they're in play. You have to protect them. And if you were specifically asked for access to them, you would have to hand those over. Some of you have those spiral bound books where you keep all of your notes and your thoughts. Just be mindful that those likely have records of personal health information in them. And again, you have to protect those records. And if specifically asked, you would have to give a right of access to those records. Let's move on to recent changes in our privacy law in Ontario. So we have had the Personal Health Information Protection Act since 2004. It's not new. So any of you are like, oh yeah, there's that new privacy law. No, it's not new. We've had it for a really long time. But what you might be thinking about is that there have been some recent changes to our health privacy rules and our law that all regulated health professionals need to know about. It's been dubbed PHIPA modernization, and our provincial government in the last couple of years has been moving to update our health privacy rules to deal with the changing technology of healthcare. And we hear the language of democratizing health information quite a lot. What does that mean? It really is a movement and a philosophy to push information into the hands of patients directly. We see a lot of technological advancements so that patients can get instant access to their information. We see this especially with lab work. COVID testing, for example, lots of people getting instant access to those results, pushing information into the hands of patients. If we ask patients what upsets them about the healthcare system, one of the things that they often talk about is lack of availability of their own information to manage their own care, worries about how long it's going to take to get a copy of a record or a report, and how much it's going to cost. So we do see some changes in our legislation in the last couple of years responding to this issue of getting people information in a really timely way. And some of those provisions are not yet in force. Some of the issues about electronic health records and giving patients access to those electronic systems electronically and not just in a paper format are not yet in force. I'm not going to cover those today because we don't have details, but I just want to put it in your minds that in the future we will have some new directions about giving people more electronic access to their health information that you hold about them. A big change that happened in 2020 was to introduce Ontario Health into our health privacy law and to address the provincial electronic health record. So you will know that Ontario Health is the new mega agency in Ontario, and it sucked up Cancer Care Ontario, Health Quality Ontario, eHealth Ontario, Trillium Gift of Life Network, and others. So it's the new mega agency. When our law was changed last year, the provincial government gave authority to Ontario Health to continue the work that eHealth Ontario has been doing for decades and its predecessor organizations to create a provincial electronic health record. So in 2020, the law got updated to acknowledge that going forward, Ontario Health is responsible to create, maintain, expand the provincial electronic health record. You may know components of this as the Connecting Ontario platform. For the most part, we see hospitals contributing to Connecting Ontario and the provincial electronic health record. There are some other components like lab information from the Ontario Lab Information System. So the idea is that eventually healthcare providers in all of the different places, workplaces, practices that they have will contribute to a provincial electronic health record and will be able to view the information entered by other parts of the healthcare system to actually provide coordinated care in Ontario when angels descend from the skies. This is what we all want, is to have access to information to improve patient outcomes. Really good quality information will improve patient outcomes. In the meantime, we're just waiting to see who's going to get onto the viewer and who's going to contribute to the viewer. Two things that you need to think about as we're moving to this future vision is that your patients will be able to access their records through Ontario Health eventually. So while right now they have to come to you to get their information or they have to go to their primary care provider to get information, In the future, they will be able to go to Ontario Health and get the complete picture of their health situation, health care that they've received. So that's got some challenges and advantages. The other thing is about lockboxes and consent directives. If and when you get onto the provincial viewer, there will be times where your patient doesn't want you or some other healthcare provider to have access to their information. And patients will be able to go to Ontario Health and give a centralized consent directive, what we used to call a lockbox, to restrict access to that information. So those are some things that are happening future state, but that role of Ontario Health is now in play. We also see in changes to our law new requirements of all health information custodians to log and audit activities in your electronic information systems. The issue of auditing has been long-standing. So while the law is updated, these rules actually aren't that new. The Information and Privacy Commissioner of Ontario has been talking about auditing since before 2014, but there was a big case. It was the Rouge Valley Hospital case where frontline staff were selling the names of new babies and new parents to registered educational savings plans. As you can imagine, that's a big deal, big privacy case. In response to that, the Privacy Commissioner at the time issued a decision recommending that all health information custodians audit their health record systems, their health information systems. And in that decision, the Assistant Commissioner at the time, Brian Beamish, wrote that audits are an essential technical safeguard to protect personal health information. They can be used to deter and detect collections, uses, and disclosures of personal health information that contravene PHIPA. In this way, they help to maintain the integrity and confidentiality of personal health information stored in electronic information systems. So, frankly, the Privacy Commissioner has been expecting that all custodians have had auditing functionality since 2014, but it wasn't part of the law per se. We always had to take reasonable steps to protect health information in our care, but it wasn't prescriptive when it came to audits and logging. That's new. Now, this provision is not yet in force, but it's coming into force very soon. So in your practice, if you're a custodian, you want to make sure you're speaking with your electronic health record provider to find out the logging capabilities of your system and see if it meets these standards. So it's section 10.1. Any of you who have to do this, I've left the detail in these slides. I'm not going to read it out for you, but the idea is there's certain kinds of activities in your electronic systems that you have to log. So there's a technical component that information is being captured, and then you also have to monitor as an auditing function. So if you're a custodian, make sure you know about this update. Another thing is digital asset interoperability. That does not exactly roll off the tongue. So what does that mean? In January 2021, our laws got updated to require that all health information custodians, if you are going to introduce any kind of new health record, health information technology, it has to meet digital asset interoperability standards that are set by Ontario Health. Shorthand, if you are a custodian, you have to make sure that you talk to your tech team, anybody who's helping you with your electronic information systems, to make sure any new system, software, hardware, program that you're going to use complies with these new standards. So that is going forward this year. If you're going to buy anything new, it has to work together. The idea, again, is that in Ontario, we need to have a system that talks to each other. No more, I'm a snowflake, I'm different, I need to have my own system. We need all healthcare providers to be working together to deliver coordinated care. So our systems need to talk to each other, And as you get new, you buy new systems, you sign on to new systems, it has to meet these standards. Now, the final update I wanted to share with you has to do with powers to the Privacy Commissioner. And the Privacy Commissioner now has greater authority to issue fines. So that's directly by the Privacy Commissioner. And there are increased penalties for privacy breaches and fines. I'm going to share with you some of the consequences in a moment, but that was another big driving force in the last year. It happened actually in March 2020 that the fines got doubled in the legislation and the Privacy Commissioner got some new powers. There have been some other changes, but those are the main ones that you as regulated health professionals need to know. Okay, so let's go on to our next topic, which is safeguards, prevention, and breach management. Let's start off with prevention. What are the security basics? Again, I'm focused on those of you who are custodians. You run your own practice or you're in a group practice and you and your partners or people with whom you share space, you are all having to be responsible for privacy. Privacy does work together with security, and you do have to be taking precautions with the health information you hold. So there's an overarching principle in privacy for safeguards that personal health information must be protected by security safeguards that are appropriate to the sensitivity of the information. So you're always thinking about, what do I have, how sensitive it is, when you're doing your analysis of what kinds of modalities are you going to use, how are you going to communicate with patients. There's a sensitivity lens that you want to bring to your analysis of what is reasonable practice. With safeguards, you do have to protect your patient information and patient records from loss, theft, unauthorized use. That's within your team. The word use in our privacy law refers to activities on your behalf as a custodian. Any activities between you and your admin team or other clinicians that work for you, that's a use internal to your team, your organization, or on your behalf. Also, unauthorized disclosure. That's when you send information outside of your practice. It might be to a school, to an employer, to the Workplace Safety and Insurance Board, to the police, to another custodian. Those are disclosures anytime you're sharing information outside of your practice. So unauthorized activities of disclosure, we have to protect against. And then we also have to protect against unauthorized modification, that's changes to the record, or unauthorized destruction to records. If there is a privacy breach, you do have to notify any affected patients of that breach, and there are certain circumstances that you have to notify the Information and Privacy Commissioner, which I'll explain in a moment. Other safeguards, you have to ensure that the records you have are retained, transferred, or disposed of in a secure way. And if some of you are doing home visits, if you keep records at a patient's home, or frankly anywhere else, those records have to be protected, and you can only keep them there with the consent of the patient. I'm about to launch into all kinds of details about safeguards. And here's what I want to say first. Sometimes when you hear about safeguards, you get overwhelmed. You just start to shut down. But what we really need to focus on is that this is not about being perfect. You do not have to be privacy perfect to be a competent, careful healthcare provider. You do have to be reasonable. So you do have to take reasonable steps. The law, I'm a lawyer. I love the word reasonable. It makes me feel warm and safe at night. We do have to be thinking about, what do I have to do to be competent, careful, and respectful of my patient's privacy? That's what I want you to focus on as we go through some of the next details. Our Information and Privacy Commissioner of Ontario has issued lots of directions for you. Now, some of you go on to the Privacy Commissioner's website, and again, you may experience a little bit of overwhelm. There's so much for you to know. Frankly, there is a lot to know about privacy, but you don't need to boil the ocean, okay? You just need to know, what do I need to know, generally speaking, to be a competent, careful, respectful clinician. So here are some of the top documents, and it just also will help you organize your thoughts. What kinds of things do you need to think about when you're talking about safeguards? So these are documents, and again, you'll have these as handouts. You can go onto the Privacy Commissioner's website and look at the details of these. So if you're going to be introducing encryption to your practice, there's some details about that. If you want to know more about ransomware or phishing, that's the PH phishing, you can get some more details of that when you're ready to absorb that information. Today, I'm going to highlight some of the content that's new from the Commissioner's Office about virtual care and working from home, because I know that for many of you, that is timely. So that's what I'm going to focus on, but you can dive into the details on your own time when you, or your staff member, if you have someone working with you that can help you understand this differently and better, you can show them this list and they may be able to go do deep dives into these topics. There's been a lot of conversation about hand hygiene during the pandemic, of course, but when we're talking about privacy, we also have to be thinking about digital hygiene, your everyday activities that contribute to a safe environment for the health information you hold. I hear a lot of different things in my practice, and where I see people going sideways when it comes to privacy has to do with activities that are convenient. And just as a reminder, convenience does not trump privacy. So when you are in a shared space, I know it could be a lot easier if you just leave your computer logged on, because logging off and logging in takes time. But try to, if you leave your computer, log off or lock it so that other people can't get on. Don't use an unattended computer, because it's quicker than going to somewhere else and logging in as yourself. You should only ever be using a health information system as yourself, not as your admin person, not as another clinician. Be careful about that kind of hygienic practice. And don't open a full chart when you really only need the demographic information, and it's right there. It's all you need. You don't need to go into getting more details. There's an overarching concept in privacy that you should only collect the minimum amount of information that you need to do your work for your role. So keep that in mind as well. A couple of other hygienic practices: don't share your passwords. I know there was a question that came in advance about, we all share the same password, is that okay? No, not okay. Everyone should have a unique password. And also, you should have a different password professionally to get into your electronic information system that is different from your personal password. One reason for that is there have been lots of circumstances where different groups have been hacked. Your personal password may be available on the dark web. You may have been hacked, you don't know. And what you don't want then is to have some kind of exposure in your professional environment because your personal email or login information or password has been compromised personally. A couple of other things going on in the safeguards realm has to do with ransomware. I could not give you a presentation on privacy without talking about this issue. So ransomware is when an external hateful hacker somewhere or organization is trying to compromise your systems, your electronic information systems. It doesn't only affect us in healthcare. All kinds of industries have been hacked. Equifax and Casino-Rama, like all kinds of different, Home Depot, Winners, everybody's trying to hack everybody all the time. But we do see some cases of hacking and ransomware in the healthcare system. So this is no longer science fiction. It absolutely happens. And this is when external groups are trying to compromise your system. One version of that is when they compromise your system, they hold it ransom. So you click on something or you open an attachment and all of a sudden your system goes black, you can no longer access your electronic systems, your health records, your business records, anything. They hold it ransom. So when we're talking about practices, digital hygiene to save yourself or prevent this from happening, there are two risky activities: clicking a link and opening an attachment, usually to an email. You will always want to have firewalls and other kinds of antivirus protection, technological solutions that you want your IT people to help you with. But your involvement, the human component to ransomware, is one of these things. And we all get these emails and they say, oh, here's an invoice to pay, or a package is being delivered. And we go, that's weird. I don't remember ordering anything. That's weird. I don't know why I'm getting an invoice. When your instincts, your body tells you, that's weird, this is the moment of mindfulness. Deep breath in, deep breath out. Do not click on a link or open an attachment if you're not clear as to the security of that, because that's where we get into problems. If for some reason you do click on something that you shouldn't have, make sure you tell your IT team. If you're working in a bigger organization, tell somebody that it's happened, because you'll want to look into that. Another big risk in security and safeguards are mobile devices. Frankly, this is the biggest financial risk to any healthcare business, is using unencrypted USB keys, laptops, or hard drives. There have been successful litigation cases of health information that was compromised, lost, or stolen with a mobile unencrypted device. So if you want to invest in one thing, if you do have to transport information outside of a safe environment, make sure any kind of USB key, laptop, hard drive is encrypted before you do it. Okay, let's keep on going. Of course, because of the pandemic, we have changing standards of safeguards and security that I wanted to bring to your attention. Two things: working from home and virtual care. So last July, we actually have a new privacy commissioner. Patricia Kosium is our new privacy commissioner. She started in July 2020. One of the first things she did in her new role is issue new guidelines about working from home during a pandemic in particular. So this is something all of you should read. It's available on the Privacy Commissioner's website, but here are some takeaway messages from those guidelines. When you're working from home, you should make sure that people with whom you share space cannot see or overhear your virtual visits. Avoid printing documents with personal health information at home. Check for any temporary downloads. You may have noted when you open up a PDF on your home computer, it may be saving a temporary download of that document. There was a case involving a woman, and she had been working from home. She was opening documents on her home computer. Unbeknownst to her, it was saving on her home computer. Unfortunately, she and her husband had a split of the marriage. He wanted to show what a terrible person she was. He found these records on their shared computer that had client information in them, took it to her employer. This became a privacy issue. So the message from the Commissioner's office is, if you are working from home, if you're on a shared device, make sure you're deleting anything in the temporary downloads folder on your system before you sign out for the night. Make sure you're locking your device or signing out of your electronic health record or your remote desktop on any shared devices, and separate out your work files from your family files. Any of you who oversee staff in a practice, another thing is that if people are working from home, they should have the option of being able to block their home phone number or their mobile device when they're contacting patients. So as an employer or someone overseeing people who are working from home, that should be an option. If they don't want to, that's fine, but they should be given that opportunity to have their home or personal number blocked. Again, reminder, if you're using any kind of portable storage device like a USB key hard drive, ensure it's encrypted and password protected. When working from home, keep your software up to date with antivirus protection. Often work computers have that, but if yourself or any of your staff have their own personal devices, make sure they've been updated with antivirus protection. And set all your privacy settings to the most privacy protective setting. Couple of other safeguards to remind you of. This is either working from home or in an office. Please do not throw health records in the garbage. Tons of cases of people putting into recycling or putting into the garbage identifiable health information. So that's a big preventative tip for you. Make sure that you're not throwing things in the garbage. Make sure you're shredding health information. Keep records out of sight of visitors, especially if you're working from home, and protect the paper that you have. That moves me right into virtual care. So the Privacy Commissioner has issued new guidelines about virtual care, and virtual visits are any kind of visit between a clinician and a patient using technology to deliver a healthcare service or assessment that's not in person. So new guidelines just came out this year, February 2021. At the beginning of the pandemic, to be honest, there was a loosening of all the privacy expectations because we were in a crisis. And in a crisis, it was expected, and the Privacy Commissioner even put something on the website to say, look, you need to, if you're a healthcare provider, you need to deliver healthcare services. There is a pandemic and a crisis. Do what you need to do in order to communicate with and continue your healthcare service. Well, a lot of months have gone by now, and we are reintroducing expectations of safeguards and security when it comes to doing virtual care. I'm also seeing this in college guidelines, that many colleges have now reissued instructions, directions on their websites with respect to telehealth, virtual care, record keeping. Sometimes you'll find it under the title COVID-19. You may find some FAQs, but if you are, all of you here are part of a regulated health professional college, make sure you are keeping up with your college standards and guidelines on this topic. From the Privacy Commissioner's perspective, she's focused on 3 modalities of virtual care: telephone consultations, which we've been doing since the dawn of time, so I'm not going to really go into that now. But she's also been focused on video conferencing and secure messaging. So we have some new directions in this regard. With respect to video conferencing, when you look at those guidelines, the February 2021 guidelines on virtual care, the Commissioner has mentioned at least 10 tips about using video conferencing. I have included the details here. So, well, it's just the headings that she has addressed in that guidance document. So if you're doing video conferencing after today's webinar, go and have a look at that document. But there were at least 10 tips about what you can do to have safer video conferencing. In the Q&A at the end, there was a particular question that I'm going to answer. So stay tuned for some more information about that. There also is new direction about emailing. And I know many of you have questions about, am I allowed to email with patients? What should I be doing? So high level, there's nothing illegal. There is nothing inappropriate about using email to communicate with your patients. But you have to take reasonable steps always to ensure that the personal health information that you hold is protected. So to help you understand your responsibilities better, the Privacy Commissioner has 2 documents I would recommend you read. One is from 2016, Communicating Personal Health Information by Email, and that February 2021 guidance document on virtual care. In that document, the Privacy Commissioner has given at least 22 tips about emailing and secure messaging. So this would include texting, but mostly email. Again, I'm not going through them for the purposes of this webinar, but I wanted to write them out for you, the headings, so that when you review these slides after the fact, you can see the main tips when you're using email or secure messaging. What is a privacy breach? You may have questions about that. There are 9 main categories of privacy breaches that you have to be thinking about and that you want to train your team on. Snooping is a big one, so that's looking at or disclosing information without authority. External threats, like we've talked about, ransomware, hacking, or theft of information. Lost and unencrypted devices. Inappropriate sharing of information within the team. Misdirected communications by mail, fax, or email, publicly posting information that should be private. So there have been, for example, a couple of cases of health records or Excel spreadsheets that either got accidentally or intentionally posted in public forums like Facebook. So there have been cases like that. Vendor mismanagement, that means you have a vendor that's working for you, like delivering your records for you, storing your information for you. What if they go rogue? So there are some cases of that. Sharing with third parties without authority, and insecure disposal. So that gives you an overview of what are the kinds of privacy breaches you want to be thinking about. If you do have a privacy breach, the Privacy Commissioner of Ontario has some guidelines as to how to take action to respond to those breaches. So I would recommend, if you have a breach or you think you've had a breach, go to the Privacy Commissioner's website. There is something called What to Do When Faced with a Privacy Breach, and they have a recommended protocol of 4 steps. Implement your privacy breach protocol, stop and contain the breach, stop it from getting worse, notify people who have been affected by the breach, and do investigation and remediation. So again, there's another document called What to Do When Faced with a Privacy Breach, Guidelines for the Health Sector, that can really give you concrete instructions of what to do in those cases. There are 2 things that you have to report if you're a custodian. If you're not a custodian, you still have to report these things, but to your internal privacy officer. You're not the one connecting with the Privacy Commissioner. It would be done by the custodian. If you're in a group practice, you may choose that one person reports on behalf of everybody. So that's up to you. That's an organizational decision. But there are 2 kinds of reports that have to be made to the Commissioner. One is an annual report, and then there are reports that you have to make in the moment. Let me explain that a little bit more. The annual statistical report happens for a calendar year. So in March, usually February or March, you have to report the previous year's information. So for 2020, that data just went in March. There are 4 things that have to be reported to the Commissioner in an annual statistical report. The number of times personal health information was stolen, the number of times personal health information was lost, the number of times personal health information was used without authority, remember that's within the team, or the number of times personal health information was disclosed outside of the team without authority. I've highlighted there for you through a misdirected fax, because most of the privacy breaches we hear about in Ontario relate to misdirected faxes. If you don't have a hit, you've had none of these privacy breaches in a year, you do not have to file a report with the Privacy Commissioner's office. But if you've had any one of these things in a calendar year, you do have to make an annual statistical report. We've had 2 years of reporting so far. The details of the 2020 breaches have not yet been published, but the Privacy Commissioner has published statistics of privacy breaches from 2019 and 2018. So in 2019, there were 12,000 privacy breaches reported to their office in Ontario. That's for all health information custodians, which tells me not all health information custodians know that they're supposed to be doing an annual statistical report, because that number is quite low given the number of custodians there are in the province. In any event, 12,000 reported breaches in those categories. 7,000 of those were misdirected faxes. So huge numbers of cases of faxes going to the wrong place. The second kind of reporting that you have to do to the Commissioner's office is reporting in the moment under certain categories. So if you've had a situation of snooping, one of your team members was looking at records inappropriately or shared information outside the team, that has to be reported to the Commissioner in the moment. If information has been stolen, if someone has received information from you inappropriately and then threatened to go public. There was a case of a physician who had terminated the therapeutic relationship with a patient. The patient was not happy about that. The physician left the room, leaving the patient in the room with the physician's computer. Now, on the physician's screen, there were 72 people's information, one of whom was the patient, on the screen. The patient took out a camera, took a picture, was really upset about being fired as a patient, and threatened to go public with that picture of the 71 other people's information. The physician had to report that to the Commissioner's office and had to tell the 71 other people that their information had been shared with this patient. But the Commissioner actually issued an order against the patient and ordered the patient to destroy that picture. Other things that you would have to report to the Commissioner in the moment is if you have a pattern of breaches. So otherwise, the breach is minor. There isn't much you don't have to report the details of it to the Commissioner. But if this has happened many times, or if you have a systems issue that is contributing to a privacy breach, you have to raise that with the Commissioner's office. In 2017, the rules changed, and if you take disciplinary action against a regulated health professional or an unregulated person, like an admin person, you have to, for a privacy breach, not for other human resource issues, but if you discipline someone or terminate employment because of a privacy breach, you have to report that to the Commissioner. Now, you also have to report if you've taken disciplinary action against a regulated health professional, you would have to report that to their college. So that is a mandatory report to the Privacy Commissioner, and if it's a regulated person, also to their college for privacy breaches. Who does that? It's the custodian. And so if you're not the custodian, you're an agent, it would be the custodian that would have that responsibility. And then there's a bucket of anything else that's significant. So if you have a privacy breach and a lot of patients were affected, or it involved highly sensitive information, or a lot of custodians were affected, you also have to report those things to the Commissioner in the moment. So just to wrap up this summary, I wanted to share with you what can go horribly wrong if you have a privacy breach. So we start at the top. Obviously, we don't want to have a privacy breach because if we do, it will negatively impact our patients or their families or caregivers, right? So of course you want to be privacy respectful, because if you are not, it can have a negative impact on your patients. Also at the bottom, you want to be careful of privacy, because if you're not, it can really negatively impact your therapeutic relationship, your ability to connect with your patients and continue to provide service. Where we have seen big privacy breaches, people don't feel safe, they don't want to come back for service, so that it can interrupt your therapeutic relationship. To the left, so what about complaints? Complaints can come directly to you. Your patients can make a complaint to you, but they can also go to the Information and Privacy Commissioner of Ontario and get a resolution there. Go to the other side, regulatory colleges. Patients can also make complaints to regulatory colleges, and we do see in many different colleges that there have been license suspensions for serious privacy breaches. So that is something to be mindful of. People can also go to court and get money. When you see the word damages, think money, People can now get up to $20,000 for intrusion upon seclusion. That's a snooping case. And we have seen some of those cases going forward in the healthcare context. And also there can be fines. So remember when I said our privacy law was updated last year with respect to fines and penalties? Well, this is one of the areas that got updated. So last year, March 2020, the privacy law was updated, and now individuals can be fined up to $200,000 and corporations can be fined up to $1 million. And now there can be jail time for serious privacy breaches. To date, there have been no corporate fines issued. The fines that have been issued, there have been 5 people successfully prosecuted in Ontario for snooping, one of whom was a social worker in a family health team. She looked at the records of 139 people. She was not providing care to them. She was a student in that family health team. It was not part of her student placement. She was fined for looking at 5 people's records, and she had a personal fine of $25,000. That's the highest fine we've seen to date. 2 people who worked in a hospital who looked at the former mayor of Toronto, Rob Ford's records before he died, they were each fined $2,500. And then in 2 different cases at 2 different hospitals, admin team members were each fined $10,000 for looking at hundreds of records not part of their jobs. So we do see some people are being sent to prosecution. This is not done by the Privacy Commissioner. This is done by the Attorney General's office. And we've 5 successful prosecutions in Ontario. Okay, well, that was my whirlwind update. Now I wanted to answer some of the questions that you as the audience posed to me. And just as a reminder, this is not legal advice. I'm just, giving you general information of how do you process these kinds of questions. So when questions come to me, there's a dilemma, and many of you will want a yes or no answer. If I can do that, I will, but often it depends. What does it depend on? It depends on the context. It depends on the further details. So you may have posed some questions that I'm going to answer today, but I may not have all of the background information. So again, just general responses, but the answers to your dilemma will often depend on knowledge, skills, and judgment. Sometimes you just have to make a decision, and we're not in perfect circumstances. So let me get to your questions. 2 questions to start off with that were similar. So this person asked, if both privacy legislations, meaning PHIPA, that's the health privacy legislation, and PIPEDA, the Personal Information Protection Electronic Documents Act, or PIPEDA, people call it, if they intersect in a health professional's practice, does one legislation supersede the other? So the federal privacy legislation, PIPEDA, is applicable to commercial practices, and it also applies to provision of service to federally regulated entities like transportation, aviation, some communications. So if you're delivering a service to a business that is federally regulated, you may be subject to the rules of PIPEDA, the federal privacy legislation. If you are operating in Ontario as a healthcare provider, you are subject to PHIPA, the Personal Health Information Protection Act, which is what we've been talking about today. Yes, it is possible that you could be regulated by both, but in Ontario, and here's the second question, are there any circumstances where PHIPA and PIPEDA can apply? Some health professionals collect both personal information and personal health information in assessments. So to answer both of these questions, it is possible. If you're a regulated health professional, you are in Ontario and you're delivering services in Ontario, you are required to comply with PHIPA. And there is a rule that Ontario's health privacy legislation was deemed substantially similar to the federal privacy rules. Prior to 2004, if you were in a commercial practice, if you charged money for your services, not publicly funded, but direct to consumer money exchanged, you are subject to the federal privacy law. That changed in 2004 because our health privacy law was deemed substantially similar. So for the provision of health care, that even if you charge money for it, you are subject to the health privacy rules. Here's the however. Some of you are delivering services outside of Ontario. For that, you may be subject to PHIPA, the federal privacy rules. If you have another business, so you deliver healthcare services, but you also sell product, you run courses, you have some kind of commercial activity that is not part of your delivery of healthcare services, you also could be subject to PHIPA. Bottom line, PHIPA and PHIPA, very similar. So you still would have obligations to safeguard information, similar, slightly different rules about access to records. But for the most part, when we're talking about safeguards, you're going to want to protect your commercial information as well as you protect your health information. So I hope that gives you some general information. Another audience participant asked, a patient wants me to destroy their records. Is that allowed? Generally, no. You will have regulatory college expectations of record keeping, and you will have college expectations for how long you keep records related to your practice. Usually 10 years for adults, and then 10 years beyond somebody's 18th birthday for children that you might have seen. So sometimes lots of clinicians will keep records for 28 years just to make sure if you also treat kids that you keep your records for a sufficient length of time. There is a concept that we're hearing about more in Europe about the right to be forgotten, and that might be something that you've heard a little bit about. We don't have that yet in Canada, and so this whole idea of I don't want you to write that down, I want you to destroy my record, I don't give you permission to keep records about me, is not an instruction that you can follow because you have regulatory guidelines to keep records. However, some of those conversations translate to a correction request. And so I would recommend that you listen for what they're asking you. And sometimes what they, if they can't get the record destroyed, they may want it corrected, and you would have an obligation to listen and respond to that request. And then another option might be a lockbox or a consent directive. They can't get it destroyed, it can't be corrected, they may want it locked so that your record is not shared elsewhere. Another question was, I'm a health information custodian. If a patient requests their chart and includes another professional's notes, should I disclose the whole chart? The answer is, it depends. Yes, if you're the custodian, the record belongs to you, but the information belongs to the patient. And any information that you hold in your record, whether you authored it or it was authored by anybody else, the patient has a right of access to that information. So for the most part, yes, you would hand it over. Sometimes, depending on the kind of practice you have, you may have multiple custodians and you share an electronic system. You are the custodian for your entered records, and then there might be another kinesiologist or physiotherapist, whomever, dietitian, who's also got records in there, and they're the custodian for their information. You have to have sorted that out within your group practice, who would give the patient access. But yes, if you've got referral information, lab information, anything from any other organization, once it's in your record, the patient has a right of access to that information through you. Another question. Patient wants to video record a treatment session. Can I refuse? Yes, you can. You absolutely can. And it's a really good idea for clinicians to have proactive conversations with patients about making recordings in advance. If you don't want someone to make a recording, you can refuse. Here's a caveat. You may not know that they've made a recording. Some people do make covert recordings and they don't tell you. If you find out after the fact that they've made a recording without your knowledge and consent, that might indicate a breakdown in the therapeutic relationship. It might not. It might be that they misunderstood, but it is something for you to have a conversation about. A covert recording is not a crime, and a lot of people have questions about this. Under the wiretap provisions of the criminal code, anybody who is a party to a conversation can actually make a recording without the knowledge and consent of the other person, but it's still rude and it still can undermine trust. So it's something to have a conversation with your patient about. Another couple of questions and then we'll be done. Audience question of all the health professionals at my organization use the same password to upload reports. Is this a privacy issue? And I already answered this to an extent. Yes, I would say that is a privacy issue. That is not good practice for everybody to have the same password. It could be a problem, for example, that others are uploading passwords as or reports as you, not so that the activity is being logged that you did it, not someone else. So that would not be best practice to share passwords. Another question was, I'm providing virtual care. Is the paid version of Zoom PHIPA compliant? If not, what is? Well, this is a bazillion-dollar question. Lots of people asking about this. At the beginning of the pandemic, it was kind of like anything goes. Use whatever platform you can get your hands on to communicate with patients. That is changing. So I can't give you legal advice on this topic, but let me share with you that Ontario Health is now verifying platforms for video conferencing. So when you need to select a vendor to help you do video conferencing, there is an online list of verified platforms. The last time I checked, these were the platforms that have already been verified. So you might want to just take a look, see if the platform you have been using is on this list. If it's not, do not panic because there are 50 plus more platforms that are being verified right now by Ontario Health, which includes Zoom and Teams. And the ones that you may use, Jane or something else, may also be on that list. So it's something that you should wait and look into. But just so that you know, yes, now we are seeing an expectation that you are using a verified platform. Another couple questions. So can I assume a family doctor is always in a patient circle of care? Yes, family physicians are in a circle of care. What does circle of care means? It means you can assume that your patient wants information shared with other healthcare providers for a healthcare purpose. A family practice, a family doctor, a nurse practitioner, any other regulated health professional, you can assume they are in your patient's circle of care. You can assume you can rely on implied consent to share information with them unless your patient has told you otherwise. If they say, don't share information with my family doctor, then you can no longer share information. Circle of care is not no consent, it's assumed implied consent. And this person wrote, if I'm no longer employed in the auto sector, if I'm called to court, can I review a client's file without consent? This is an it depends question. It depends if you are a defendant in a court proceeding, you would be allowed to go and review documentation relating to a service for which you're being sued, or you're named as one of the participants in having, conducted wrong activities. You can look at the record if the former employer gives it to you to refresh your memory in advance of being a witness. Otherwise, probably not. You would have to wait until you were called as a witness, and when you're on the stand, then you would be asked to review records that you wrote at the time. Okay, final last question. Is it permitted from a privacy perspective to provide personal health documents to the Workplace Safety and Insurance Board for claims about a patient? It depends. So generally speaking, you will get consent, express consent from a patient before you send information to an insurance company or any other authority like a Workplace Safety and Insurance Board. You'll get an express consent that's in writing or a verbal oral consent. The alternative is that some of these regulated authorities, like a Workplace Safety and Insurance Board or a Children's Aid Society, for example, they may have the legal authority to compel you to release information to them. If that's the case, ask them. Ask WSIB. Well, you've asked for my records, but you haven't given me an express consent. Are you compelling me to disclose information to you? Ask them to put it in writing. I want to thank you for your attention today. I know this was a lot of information. I hope you found it educational. If you need more privacy support, I have lots of things that might assist you. So I do a free monthly Ask Me Anything About Health Privacy for Health Information Custodians. It's the first Wednesday of every month, although I don't do it in the summer. I also have, as one of the handouts today, the summary of all the decisions of the Privacy Commissioner that will help you understand privacy better for your practice. If you are a privacy officer or if you have one on your team, I do Privacy Officer Foundations training, everything you need to know about being a privacy officer and how to do that role. And the next course starts in September. I also offer team training. I love training. It's one of my favorite things. And I would invite you, if you'd like some training for you and your team, I'm happy to do that virtually right now, but in person in the future. And also, if you need help with your policies or answers to questions that you have about privacy breaches or privacy practices, that's what I do for a living, so I'm happy to help you there. And details are at katedewhirst.com. Thank you. Good luck with your practices, and I wish you well for your privacy compliance. Thank you for being part of this webinar.